So we're live now. So hi everyone. Thank you for coming to this sharing session. And we are very excited today to have one of our steering committee members and our main sponsors for this hackathon, JUMPstart from JUMPstart, Dr. Maya Gurnani, who will be actually sharing with us what JUMPstart has in store for our hackathon participants, especially for those who have made it through to the final, and the very unique program that they'll be offering for our finalists. So just to give a quick introduction of Dr. Mayang. So Dr. Mayang is a global healthcare executive with over 2 decades of experience in clinical medicine, research, and in commercial roles, such as insight strategy and BD&L. He has expertise in identifying, investing, and building new ventures across drugs, devices, diagnostics, and digital health, with deep understanding of the regulatory, reimbursement, and market access requirements. His demonstrated experience as a clinician, founder, investor, and new venture builder, leveraging integrated clinical and commercial skill sets, and is passionate about driving innovation to transformational impact on patient care. So Dr. Mayang is a physician by training, licensed in India and USA, and holds dual masters, an MBA specializing in strategy and marketing, and an MS specializing in health economics and market access. And he currently serves as program director at JUMPstart NUS. So we're very happy to have him here today, and he will be kickstarting his sharing now.
All right. Thanks, Joel. Thanks, everyone. Benson and the team have done a fabulous job putting this event together. So my congratulations to you and the whole group for doing a fabulous job. I've been interacting with these guys, and I've always found them very passionate and very driven to make sure that this event is a success, and I wish them all the best. So for today, what I'm going to do is going to introduce the program to you, the JUMPstart program to you. You might have heard about it in the ecosystem. It's one of the most popular programs, arguably one of the most successful ones in the ecosystem. And then I'll also be covering about our upcoming digital health bootcamp, which Joel kindly mentioned as something which is available for BHH participants to sort of think about as they take the next step. So if you want to expand your thinking and if you want to go bigger and stronger into the digital health ecosystem, we have the resources to help you. So, I look forward to sharing these slides with you and then hearing from you if you have any questions or comments. We'll take that in the last 5-10 minutes of the session. Okay, if that is okay, and you can see my slides, maybe I'll start. Okay, so JUMPstart is an acronym for the Joint University MedTech Program. It's basically a program put together by the 3 largest universities within Singapore, NES, NTU, and SUTD, and it's supported by Enterprise Singapore. So what is the background for JUMPstart? A little bit of history. JUMPstart has been around since around 6 years. The gap that JUMPstart identified was that during the developmental phase of projects, university startups were unable to find the right kind of infrastructure to actually make those projects successful. So infrastructure here is not just hard infrastructure, it also means soft infrastructure. Where you have the right mentors, the right funding, the right guidance available to actually make your medtech devices. So funded by MOE, we started this program in 2015, 2016. We have been running this for around 5 years now. Basically, it is a collaborative program. It has nodes across NES, NTU, SUTD, and we bring projects from within these 3 ecosystems through a very collaborative mechanism. It creates a pan-Singapore-wide clinical collaboration as well, because we collaborate with the hospitals across Singapore. So the cohorts run in a 6-monthly fashion. We have trained approximately 100 entrepreneurs so far. They have created multiple new ventures, 34 as of last counting. We have 4 companies which have become global companies. 5th one coming up very soon. I don't know if you've heard about Bethonics, which is coming online right now. So that's the 5th company which will become part of this. The companies are in total valued at over $150 million enterprise value. And they have raised at least 22 million of private money. So they raise private. We don't monitor public money because we consider that as grants and those as non-validation. We consider the private money as validation. So that's quite a serious benchmark for us. That's one of the reasons we are a serious program compared to many other programs that you will see, because we talk about real projects and real money. We don't talk about just supporting projects for the sake of supporting. We only identify the best projects and take them forward. So how do we do this? We run an industry-driven program, basically work closely with industry mentors and participants. We break down these large pieces, regulatory, reimbursement, market access, things which are very complex, into very small modules, which help teams structure their businesses around them. We don't have a like a split team arrangement. We have a very dedicated team who only focuses on these things, only accelerates these projects to market. We combine both product and business development together, because we think just focusing on product development or just focusing on business development is not going to get you anywhere. You need to have a clear path to market. And we focus on the founder, the bio entrepreneur at the core of the business. We don't just focus on the key business aspects or key product aspects, but also on the people side of the business. So startups have two opportunities to usually come into JUMPstart. One is at a stage, we divide into two stages. One is the ECD stage, and the other is the QMI stage. The ECD stage is more like a entrepreneur and commercial development stage, where you form business models, you get your first set of money, and you basically conduct proof of concept experiments. QMI is the longer, more detailed study, more detailed phase, where projects can go and conduct the product development and take regulatory approval and basically go to market. So this is a more serious, more deeper, and this is a more commercially oriented part of it. Basically, there are multiple modules, and there's a list of these modules. I will go into detail, but we have a model which covers all these different aspects and make sure that all the teams have received the right support as per their level. So at least a 6-month program I can talk about. They received up to $750,000 of funding. They get incubation space. They get access to the community. They work with the clinicians, and they receive basically databases, access to databases. We run them through different modules. So value proposition, go to market, regulatory strategy, reimbursement, clinical, transaction. So some of the partners, we don't do this all by ourselves. So we have a lot of clinical partners, of course, a bunch of innovation partners who actually make it happen, and global partners who actually drive it forward. We believe that it's important to have these local ideas get a global reach. And these are some examples of the companies that you might have heard about JUMPstart so far. So Rocesso, Pedra, Articase, Biorhythm, Vitonics, Icura, FathomX, Prognoi, C3A, IOTA MedTech. Some of them are extremely well known in the ecosystem. They're going global as well. So we are very proud of these teams. And these are our newest teams. We just inducted our cohort 7, which is 7 teams that we have just inducted. We're now recruiting for cohort 8. And as part of that recruitment, we are currently seeking applications from projects. Primarily for digital health side, we have created a new digital health bootcamp, which is basically 6 days of dedicated workshops for teams to get. It's like a on-ramp for teams to get onboarded onto JUMPstart and what is required. It helps teams basically selected teams from beyond health tech to further develop their idea and to show strategic project progress. And they get potential entry into the JUMPstart main program, which is the next cohort 8, starting early next year. They can basically access the JUMPstart community as well. So they will expand their boundaries. They will have access to funding. They will have access to different activities that are happening, and this is ongoing at the moment. So for those of you who might be interested, we will be releasing more information through the BHH Secretariat. So you will get more information on how to apply and where to go. But if you want to sort of keep a tab on what's going on with Jumpstart and what the future holds, please scan this QR code on the right with the LinkedIn, with the in logo. Please do scan and follow the page. We release most of our updates there. You also get them on the website, but I think the quickest and the fastest way is to see where things are. You can go to the LinkedIn website and see all the updates and basically sign up to our newsletter and also to any information coming out about the digital health bootcamp. So the approximate timing for the digital health bootcamp is September of this year. It will be 6 days. We'll have a bunch of people. So we have currently got people from Fitbit, Google, Hallmusk, Zulke, KPMG, and a lot of investors and a lot of other organizations signed up for this program. And we hope that some of you can also join it and take the best out of it. So with this, I will stop my short presentation. I was told I have around 15-20 minutes, so I've covered this. I would like to use the remaining time to answer any questions or comments you might have, and yeah.
Dr. Maya, maybe I can start off. Just wanted to ask, is the digital health bootcamp opportunity open to all of our participants or only selected?
I think it's open to everybody to apply, but we will have some criteria in terms of selecting those. We may not necessarily just limit it to the finalists for BHI. So our agenda is to identify good projects, not just projects which are good at the moment, but projects which are likely to become better as time passes. So we don't want to restrict to only finalists or only underdogs. We think it should be open to anybody to apply and make the best out of it.
Fantastic. That's great.
Yeah, I would just like to open the floor to any of our guests who are listening in. If you have any questions, please feel free to use the Q&A tab so that we can identify the questions and bring them up.
Dr. Maya, maybe I can ask another question. So I understand that the title of the exclusive program for BHH participants is the Digital Health Bootcamp. But what if teams are exploring perhaps mixed modality solutions that incorporate physical elements as well, or maybe purely physical solutions in the case of maybe some of our osteoarthritis or work-related MSD participants? Yeah.
So what's the question?
So would they be applicable to apply for the bootcamp program as well? Yeah, I guess.
Yeah. I don't think there's any stopping anyone for a specific physical or a mechanical device versus a non-mechanical device. That's not the point. The point is which of these projects will benefit from going to the digital health program.
Okay, sounds great.
Yeah, that's the focus.
Fantastic. Yeah. And definitely encourage all of our participants to consider applying for this very exclusive program with JUMPstart. I think it's a really great opportunity.
Yeah.
And definitely, sorry, Dr. Mayan, please.
I'm saying we have a few of these such programs that we are planning. So I mean, even if you're not interested in this particular one, then you can simply sign up for the LinkedIn and for the newsletter. So you get updated on any subsequent workshops, events that we do, which you want to attend. For example, this Friday, we also have a demo day for the Catalyst program, which we are also supporting. And we hope that some of the teams from the Catalyst program can also join the digital program. And then there is the Medical Grant Challenge as well. So we are constantly engaging with the community and seeing what are the best opportunities available. And the challenge is to basically develop the JUMPstart program such that more and more teams can onboard. And as the world transitions to post-COVID, these opportunities to transform healthcare are available for these teams to basically develop their projects and bring them out to the patients who need it.
Yeah, fantastic. So actually, Dr. Maya, we do have a question. This is from one of our mentors, Marshall Liu, and he's asking if JUMPstart is open to working professionals as well.
Yeah, absolutely. That's not a problem. We actually, for the first 6 months, the program we do have a working professionals available. They do work on the programs, but the challenge is not just from a JUMPstart point of view. From running a startup business point of view, it needs full-time people. But you first need to check whether your business has the potential to become a startup business, not just from a your personal risk point of view, but also from a business risk point of view. Is your business sustainable, and can you run it by doing it full time? If not, don't just take leaps without understanding what you're going into. So there should be a mechanism for people to do that, and JUMPstart is one of those mechanisms. It allows people to do their day job while coming on with JUMPstart, at least for some time, before they can actually do it full time. And that's where most of the startups that you see are coming from. Most of the startups that you see are coming from folks who are either in a postdoc, are doing their masters, have completed their masters, have gone to work with an MNC, have an idea they want to work. They come back to JUMPstart, they work with JUMPstart to develop it. So it's not necessarily that all of them are full time. All of them are full time at the same time. Some of them are full time at some time, some of them are part time. So they all make the best of what is available to them. JUMPstart supports that.
Yep, fantastic response. So, Marshall, looking forward to your application. All right, seeing as there are maybe no further questions, just wanted to check, Dr. Mang, you have any closing words for this address?
Yeah, I would like to thank you again and for the whole committee for having me today. And then I look forward to hearing from your community. I'm happy to address any questions people have in the future. You have my contact details and happy to have a chit chat session as well. If you need any specific feedback on how to apply for JUMPstart, how to move your project forward, I'm happy to mentor and guide as well.
Definitely. So if anyone is curious, you can find Dr. Mayang on LinkedIn as well and connect with him and take any discussions offline as well. Yep. So with that, I'd just like to thank everyone for coming down. I'd like to thank Dr. Mayang for giving us his time as well as introducing this very exciting program to all BHH participants. And look forward to seeing all of you all in the underdog bracket as well as for our later sharing sessions. Thanks for coming down, everyone. Bye-bye.
Thank you. Bye-bye.
Thank you. Bye.